Okay, so this type of case I've been talking about for a long time, but I haven't posted much about it. It's, I think, really helpful and important information for restorative dentists, cosmetic dentists, and for orthodontists primarily. So we have a situation. I'm going to show you two versions of the same plan. So maybe just focus on the left for a second. Oop, hang on one sec. Okay, so this is the same mouth, but if you look at the left, we have some minor spacing. This is the patient's main concern. We have a smaller space here, more of a dark triangle with a little space here, but we have about a millimeter space here. Now, compounded with that, we have some moderate lower crowding, minor to moderate lower crowding. Now, this is not a favorable combination. When you have upper and lower space or upper and lower crowding, that's the normal presentation. But the challenge here is that when you make these lower teeth straight, the tendency is going to be for this arch to round out a little bit. And you can see that here. So when you do this, you find the room to line the teeth up. Now, if the upper teeth were similarly crowded like this, that would be a simple case of upper and lower alignment with a little bit of forward movement. But the problem on the upper is that we don't want to bring these teeth forward because that would increase the spacing between the teeth. And you can see that right over here. So in this plan, we have a balance of the upper and lower teeth. So we maintain a comfortable anterior occlusion, but we still have spaces on top. Now I've made the spaces more proportional. So I close that space about halfway, but we still have a space here that's a little bit bigger, and we have a new space here that we didn't have. Now, this is the easiest way to go, but you might be thinking, hey, the patient came in with a chief complaint of wanting to close the space. So the way that a lot of orthodontists would do, or especially maybe general dentists who kind of will just go with what Invisalign's default is if this patient says, I want these spaces closed, here we are, same mouth, but in this version, you're going to see a retraction to close the space, an inward movement. That's what would be required to close all the spacing. And I didn't even mention there was a space distal to the canine over here. So let's say the space wants that all closed, you have to retract the arch. But the lower teeth are in the way of that because you would have anterior prematurities. So if you want to get the lower teeth straight, you do so by aligning them and moving them in. Well, how do you have the room for that? You have to do what's called interproximal reduction. And this is a lot of interproximal reduction in this case. And these teeth are not particularly wide. Interproximal reduction is safe and necessary for a lot of cases. But in this case, the variable that we haven't even talked about, in moving the teeth inward, the patient already has a considerable amount of anterior wear on their teeth in their current bite. And when you move teeth inward like this, you're going to even have more interocclusal force, less freeway space, and the wear is going to get worse. Not to mention that it's moving the teeth inward and they're going to be less visible and less of a factor in this patient's sort of overall smile, which is what they came in for. Yes, they want the space closed, but they may not really understand the full picture, so to speak, of what a smile could be if it had more fullness. So in this plan, what I told the patient day one is something they oftentimes do not want to hear, and they can walk out upset or surprised, but I would not administer this treatment plan. I would only administer this treatment plan. And what the patient would do after the treatment is they would get restorations on the front 4 teeth, maybe even the front 6. And these teeth could benefit from restorations because they have a lot of enamel wear on them, and it would close the space and change the morphology of the teeth, and the bite would be balanced. We could even leave a little bit more clearance than you see here if we need to. And so what seems like a simple case can get you in trouble if you just look at it myopic fashion of focusing in as being a orthodontic provider and just closing the space without factoring in the bite and the tooth shape and the disparity between the lower crowding and the upper spacing.